All right, thank you very much. Hello, the folk who are connected up. I understand there are about 140 or so people connected. Handsworth Church, I greet you in Jesus' name. It's good to see you and meet with you again, even though I'm far away, the continent of Australia. But I remember my time with you, and I just so much enjoy being able to minister and to share with you a word at this hour. So my scripture reading is taken from the book of 2 Chronicles, and it's chapter 7 and verse 14. So that's 2 Chronicles, chapter 7 and verse 14. And the word declares, "If my people, which are called by my name, shall humble themselves and pray, and seek my face, and turn from their wicked ways, then will I hear from heaven, and will forgive their sins, and will heal their lands." And this morning I want to share for a short while on the message, Hope for Heavy Hearts. Hope for Heavy Hearts. What I thought I would do is to divide up the presentation into two parts. One part, I just want to deal on the question of the COVID-19 and general principles of health that you will find important or useful to you. And in the second part, I'll share with you a word from the Lord. So let us pray. Father, we thank you for this opportunity to speak a word, and we ask that your Spirit will guide and be abundant in our lives as we listen to what you have to say to us in Jesus' name. Amen. All right, now a couple of things. Let's start with the COVID story. So COVID-19, as we know, started in sometime in December of 2019. That's why it's called the COVID-19. It started with one person in the Wuhan province of China. And by January, it had spread to mainland England and Europe and America, and of course, within 3 months, it had spread all over the world. It is a very virulent virus, very virulent. It belongs to a group of viruses called the coronaviruses. Now, the coronaviruses are a common group of viruses, including that which causes the common cold. But this is a new variant of the coronavirus. So it's called new variant COVID or coronavirus 19 because it was presented or discovered in 2019. And it continues to be a major problem for all over the world. It's already affected 7 continents. It's spread literally everywhere all over the world. Our current statistic shows that it has infected over 7 million people with a death. It's already had a death toll of 1.6 million. So it's quite a serious, a very significant virus. Sorry, that's 70 million with a death toll of 1.6 million. 70 million people affected. So it's a very serious virus. And what we are seeing, of course, are now not only the virus in its first form, but mutated forms of the virus have also appeared. Now, this virus is called an mRNA virus. It's an RNA virus as opposed to a DNA type bacteria or a viral particle. This is an mRNA. It's a messenger RNA, which means to say that it uses the host's own body to create more virus. It's the ultimate parasite. So when it infects the host, it goes into the cell of the host, the person who gets it, and then it replicates itself using the DNA structure of the host to produce more mRNA. So it's one of those viruses that are very effective in terms of its job. Now, the actual cause of the virus remains unknown. We know it started in the Wuhan province, but as to what the actual sequence of how it was caused remains a mystery. We do not know. More investigations need to be done, and there are a number of inquiries that have been initiated by the World Health Organization and a number of international groups and bodies to see if they could find out what was the cause. In some regards, I think that is a bit of a red herring. I think it's important to go back to track it, to trace it, so that it doesn't happen again if possible. But the truth of the matter is the virus is here. The virus is here. That is the reality of what we're dealing with. this virus is real. I know there's a lot of conspiracy theory out there saying it doesn't exist. Ladies and gentlemen, this virus is real. People are dying, and they're not dying from electromagnetic energy and from the cell towers and all the sort of things that people are going around with. That is not the story at all. People are dying because of a virus, and that virus is killing them, for sure. So I think the first thing we have to establish very clearly is we are dealing with something real. If we don't acknowledge that, we are going to find ourselves in a position where we are not protecting ourselves. And it is for this reason we see in many countries, particularly in Europe and North America, where people have taken the position that this is not a real disease, and they have allowed themselves to be exposed to the virus. America stands as one of the examples of a country that they have lost control. This just yesterday and the day before, they're looking at 230,000 new cases a day. I mean, you cannot even begin to interpret that number. Also see it in Spain, and in Germany it's gotten back up. In Europe, in England, where we are addressing, it is out of control. It is a true pandemic. It is a true pestilence of a global nature and of a serious nature, and I think everyone should take it seriously, really, really seriously. From a person who works in the front line, I can tell you for sure, this kills people. This is killing people. And I was listening on to your audience, and I saw that there were a couple of people, a lady who came up and said she had it and all the problems that came with it, the breathing difficulties and so on, and obviously God has helped her, she survived. But there are many people who are not survived, and they are dying. So I want to first of all emphasize a very serious and salient message that this is real. Ladies and gentlemen, this is real. And we've got to come to terms with that concept and idea and disband the whole conspiracy theory that this is all fake news. This is not fake news, this is real. So that's the first one. Now, again, we're not entirely sure how the whole transmission occurred. It is thought that this particular virus, which exists, may have been transmitted through the pangolins, which had covered animals, or that they were used maybe for insects for eating, and transmitted through bats. Bats are natural harbors of the COVID-19. It can live in bats, it doesn't trouble them, but if it spreads into the human population, either through animals or by direct contact, some people say people drink blood, all sorts of bats' blood, all sorts of things, we do not know. The point is, the virus, when it affects the human the way it has, will become a potential lethal virus. Now, in terms of how it is transmitted is really important in terms of how you protect yourself, and then I'll talk about the Australian experience in a while. Because it is transmitted largely by contact, or respiratory, or fomite or contact on surfaces, those are the two major areas by which you can get it. So the respiratory spread through the nasal mucosa or through the mouth, you can get it that way, or you can get it if you're in contact with the virus that's sitting on a surface. Now we know the virus can live on the surface, particularly metal surfaces, for as long as 3 days. That's the current statistic. It can stick as long as 3 days on a metal surface. So if you're in contact with it, and then you rub your face, you rub your eyes and so on, any of the mucosal entry points, then the virus will get into the system and cause disease. Now initially when it started, we thought it was largely a respiratory virus, and it was largely a respiratory virus. But since then we've also found out that it can affect every organ of the body. It can affect the gastrointestinal tract, it can affect the heart, it can affect the brain, not just the lung only, even though the lung appears to be the primary target of the virus. It's not the only target of the virus. So you can get people are coming out with cardiac problems, kidney problems, brain problems, and so on, all because the virus is very effective at targeting multiple organ systems. Now, the question, of course, that you asked then, based on that, who are most at risk? Well, the people that are most at risk are those who have an immune system that is not able effectively to deal or fight with the virus, which means to say that if somebody is old, the older group who cannot mount an effective immune response, so the older age groups, or anybody who has got pre-existing conditions such as respiratory conditions, chronic obstructive pulmonary disease, asthma. We know it also works through a number of enzymes that are linked to high blood pressure or the hypertensive system, so that people who have high blood pressure, who are on medication for high blood pressure, seem to also be not able to compensate for the virus when it affects the body. Now, so we're looking at groups. The group we're looking at is the elderly groups. We're looking at those who have coexisting respiratory or cardiac disease or high blood pressure. And the third group is anybody who's got immune compromise. So for example, somebody who's got cancer, or somebody who's got one of the autoimmune diseases. Anything like that can in fact you can become a target for the virus, and you can succumb to the virus. Now, the virus of itself is not what kills you. I want to make that very clear. The virus is not what kills you. What kills you is the response of the body to the virus. So it gives you what is called a cytokine storm. So whenever you're exposed to a virus, whenever we're exposed to a virus, the body produces a number of naturally occurring chemicals called cytokines, anti-inflammatory and inflammatory chemicals, which target the virus, target the bacteria, and try to get rid of it. And that is what is called a cytokine or response of the immune system. Well, in the case of the COVID-19, it causes a response that is called a cytokine storm, so that you not only get the response of the virus, the body to the virus, in its normally regulatory system, it gets an overwhelming response. The body overwhelmingly responds to it, and it produces a number of inflammatory conditions affecting various organs, the primary one being the lung. So you get this organ inflammation of the lung, and that's why many people who get or most people who get the virus present with lung symptoms. Symptoms very similar to what we call systemic inflammatory response syndrome, something that I used to see quite often when I was operating in the cardiac. I used to operate in cardiac doing open heart surgery. It's very similar to that condition, but people can also present with bowel or diarrheal symptoms. They can present with mucosal symptoms of the eyes, respiratory symptoms affecting the nose. So people can lose their sense of taste, their sense of smell in the more minor conditions. But the more florid conditions would give you complete lung shutdown. It will give you cardiac problems. It will give you gastrointestinal, kidney problems people are seeing as well. The actual mortality depends on a number of factors, but what we do know from our current statistic is that it would affect between 1% and 3% of people who get the virus will die from it. Between 1% and 3%. That's where it seems to be the current statistic. Now, you would argue to yourself that that doesn't seem to be very high. Well, if you multiply 1% to 3% by a population of 8 billion, which is approximately what the world's population currently is, that number is staggering. That's absolutely staggering. And so what we're seeing in all countries, England, America, lots of parts of Europe, and many parts of the world, is that the number of COVID-19 cases are coming through so fast that they are overwhelming the medical system. It's not only a case of the numbers that are coming through, it's the numbers are coming through so rapidly that the medical system cannot keep up with them. It cannot cope with it, because the treatment for the early stages of COVID-19 would be just monitoring and observation. And in the second stages, when the respiratory system becomes affected, you will require to go to a high dependency unit. And then a certain percentage, approximately 0.5 to 1% of the total, will end up going onto a ventilator, and the mortality of that is 50%. So 50% of people who end up on a ventilator die on the ventilator. So the numbers are just becoming absolutely staggering, and they are overwhelming the current medical systems, the ability of the medical system to deal with it, and also considering the fact that there are other medical conditions that need attention. People still get cancer, people still get diabetes, people still get pneumonia, people still get all sorts of medical conditions, people still need operations that require them to be in hospital. And so the issue for the COVID-19 is not only the fact that it affects relatively a large number of people, its infectivity is very high, is the fact that when it does affect people, it is blocking the medical care system, and therefore you can't pay attention to any of the other conditions. So that in summary is a very broad outline of the COVID situation. Now, how therefore do you protect yourself? Well, the method of protection is very simple. It's basically biosecurity methods. That's it. It's biosecurity. It's regarding and being respectful of the ways in which the virus is transmitted. So let me refer to the Australian story. So in Australia, we have about 27 million people, population, and there are 7 states, 3 territories. And when the COVID affected Australia, which it did, in the month of March approximately, we started seeing our first cases. When we started to look at the replication of the virus in the body, it was following the same pattern that was seen in North America, that was seen in England. It was following a very steep curve. And so the prediction would be that the medical system of Australia would become overwhelmed because the rate was doubling so fast. The R0, which is the rate of replication, is approximately 3. So for every time one person gets infected, they infect 3 more. So the replicating time or the doubling time is extremely very, very rapid. And so a strategy was put in place in the Australian and New Zealand environment, which has actually worked very effectively. And that strategy was that of bioprotection. And so for about 4 weeks, in literally every state and territory, people were confined to home, and they could only go out for essential services. They also had strict hygiene in terms of hand hygiene, so washing of their hands, using the alcohol sanitation. Washing, of course, is much more effective, but using alcohol sanitation. They kept the social distancing, which was approximately 2 meters at the time. There was no contact, there was no shaking of hands. You had to do the sort of bounce and so on. And people generally were compliant. And I think this is largely what has contributed to the success we've seen in Australia. There was a great compliance. The Australian population did exactly what it was told to do. People stayed at home. The cases that were coming up were quickly contact traced, because what you have to do when you have a case is you have to identify the case, and then you have to contact trace who are the people that have been contacted by them. And then after that, you have to put an isolation strategy in place. So they're isolated and treated. And by doing contact tracing, by doing monitoring, by doing isolation, they were able to get containment and control. Now, that being said, there are still sporadic outbreaks of the virus in Australia. A few months ago, we had quite a large spread, a large cluster that became a large number in Melbourne, which is one of the states of Australia, and that became quite a large number. It was approximately going up to 700 and 800 cases per day. But the strategy that was put in place was very effective. They went into complete shutdown, a stage 4 shutdown. It was masked. Everybody had to wear a mask. There was no social contact. All the essential services were kept open, but non-essential services were closed. And it took about 6 or 8 weeks, but they were able to get control again of the virus. So I think that is the approach is really a very sensible one. It is one of protecting yourself and protecting your fellow man by being compliant and by doing the things that are required to keep yourself safe in the presence of a virus that is spreading very rapidly and which you cannot see. This is the classical unseen enemy. It's an unseen enemy. We don't know who has it. A person can have it for 3 to 4 days and then pass it on, so that the person can be a carrier of the disease, and you can get that simply because they are in contact with you and you didn't take necessary biosecurity measures. So the virus is quite serious, and its transmission is very easy. And because Australia was able to maintain and be compliant towards the strategies that were employed, to a large degree, Australia has got good control of the virus. Australia would stand as unique among the countries of the world in essentially having not completely controlled, but largely contained the virus, so that the living in Australia is almost back at least where we are now in Queensland, is almost back to normal. Now, that does not mean that one should be off guard, caught off guard, and not do the necessary things that are required. So we still are required to do our social isolation. Our churches have restricted numbers, but we don't at this point where I'm in Queensland need to wear masks. But I think if you live in a place where there is a lot of disease, it will probably be a very good idea to at least protect yourself with an N95 mask, a mask that covers the face completely, and making sure that you maintain social distancing and biosecurity measures so that you're not in contact with people. That has pretty catastrophic effects on the economy, that has been for sure. And many governments have had to overcome that by putting money into the economy and doing quantitative easing. But it is required at this time in order to keep the economies of the world going. So today, right now, where we are is we are in the midst of a very deep pandemic. The world is on its knees, ladies and gentlemen. The world is on its knees. The only hope that has really showed itself based on the current spread of contagion has been the hope of a vaccine. They have looked at a number of drugs and drug options. There was a lot of talk about chloroquine or the Plaquenil, as we call it in this country, with chloroquine. Well, the evidence did not show that was particularly effective. It certainly didn't have the evidence to support it. They've looked at Resdiravir, which is one of these antivirals that is used for HIV, which seems to have some effect. They're looking at the use of immunoglobulins, and so there's lots of things that are on board. But in this case here, the best way to protect yourself is the best prevention. The best treatment is a prevention strategy. That's the better way to put it. The best treatment is a prevention strategy. Rather than get it, try to prevent yourself from getting it. Right now, to close this little section, and I'll open the floor to any questions you have, is they're looking at the use of a vaccine. Now, as we know, the vaccine, Pfizer, Moderna, a number of companies are producing vaccines, and those vaccines are currently being issued to people in England, America. We don't have it in Australia yet, but they hope to launch it in March. And that might be hopefully a hope for trying to contain the disease, to try and get enough people immunized so that you have what is called a herd immunity. You have enough people protected so that they don't, you can contain and control the virus. This, ladies and gentlemen, is going to be a long process. I don't want anybody listening to me to get any illusions about what we are dealing with. What we are dealing with, even if you can get the vaccine, the numbers of vaccines up and being able to administer it to the number of people, we're looking at 8 billion people in the earth. Now, not that you'd have to give everybody, but you certainly have to give a significant number of those people vaccines. The process of getting all of this done is anywhere in the realm of 2 to 3 years. There is just nowhere outside of this. It is going to be in the realm of 2 to 3 years. So I don't want people to go with the notion that a vaccine is now available. In 6 weeks' time, I'm going to be on the road doing everything to normal. That is just not the facts. Those are not the facts. The other issue with the vaccine is that we don't know as yet how long the vaccine would last. So a lot of it is going to be literally ongoing monitoring of the vaccine. It's not been tested long enough to know if this thing is going to last 6 months, 6 years, or 6 days. That we do not know. So the vaccine is our best hope, but despite the fact that it is our best hope, it is still an unknown quantity. We don't know if it will give the level of protection. We don't know if it's going to be of benefit to the elderly, because most of the trials have not been done in the elderly. We don't know how children will respond to it. We know right now that there are a few groups that have been shown to have problems with it. If you have a tendency to allergies, they're now advising that you shouldn't take the vaccine. But for the majority of people, the vaccine should be ones that would be used with the hope that you can contain enough of the virus in a small population so that the virus itself can die out. So that's really where we are at. But the world is in a mess, ladies and gentlemen. The world is in a mess, and I don't want to sound catastrophic. I don't want to sound pessimistic, which I'm not. But I believe that Jesus said that this is what we will see at the end of time. The Bible says when Jesus was speaking of the end of time, he says there will be wars and reports of wars. there shall be famines, earthquakes, and pestilences in many places. Well, ladies and gentlemen, if that time is not now, I don't know when it is. We are seeing earthquakes, we're seeing cyclones, hurricanes, we're seeing wars and reports of wars all over the world still. And now we're seeing a pestilence that is anywhere close to what used to occur in the days of the Spanish flu. So I think Jesus says when these things would happen, men's heart would fail them for fear as they look upon the things that are coming upon the earth. And today, ladies and gentlemen, brothers and sisters, men's hearts are failing them for fear. People are afraid. People are afraid to go out. People are afraid to stay in. People are afraid of what the economy will bring. People are afraid of what the world is going to bring in terms of its political situation, the stresses that are going on around the major economies of the world, the major politics of the world. The world is on a knife edge. They tell me that the doomsday clock is now 90 seconds. The only time it has been closer was during the Cuban Missile Crisis. That's the only time we have stood closer to a catastrophic world event, a so-called, it's called end of the world event. The closest time we've had, other than where we are now, is the Cuban Missile Crisis of the 1960s. So, ladies and gentlemen, men's heart are failing them for fear. Men's heart, Jesus said, will be scared, but we need not be afraid. We need not lose hope. And that's why in the next part of this little message I'll share with you, I've entitled it, Hope for the Heavy Hearts. Because so many people feel hopeless. So many people feel depressed and downtrodden. So many people are discouraged. And I want to say to us, ladies and gentlemen, brothers and sisters, there is hope. There is hope today. And that hope comes in the scriptures. It comes in the Word of God. It comes from Yeshua HaMashiach, the Lord or Messiah. And so in a short while, after this little break, I will share a short message with you, which I have entitled, Hope for the Heavy Hearts. So I hope, ladies and gentlemen, what I've said is helpful to you, that it will encourage you to be careful. This is a Christmas season, but it is a COVID season. And I'm praying that you would be careful. You would not take chances with your own health or the health of your family or the health of someone else, and that you would be responsible, because it is required that you be responsible to the information that you have received. There are different types of vaccines that are available. There's a vaccine which are fragments of the RNA, and the whole objective of all of these vaccines is to try and produce an immune response. So none of them are really decided to really cause a replication. They're not meant to be replication vaccines. So one type is fragments of the RNA of the virus, and the immune system will respond to that, to this what's called the spike proteins that are sitting on the surface of the virus, of the virus particle fragment, and produce an immune response that protects the body. So the whole thing is the immune system. The other one they're using is live attenuated viruses. So they're attenuating the virus so that the virus particle itself does not create a disease, does not replicate, but the body's immune system is able to respond to it. So, and those are the two basic variants. So the answer to that is neither. It is just causing the body to produce an immune response to it. It's not a replicating virus. It's not a replicating vaccine. It is certainly it's a vaccine that is meant to cause an immune response. There is a treatment strategy. A treatment strategy is where you're looking at I suppose containment of the virus, preventing yourself from getting access to the virus by biosecurity measures, and of course we're looking at drugs or the vaccine. Those are along the treatment package. Where we're looking at the preventative approach, we know that the immune system that is healthy and balanced stands the best chance for fighting actively or effectively fighting the disease. We know that for sure because we know that the elderly whose immune system is not able to mount a response, or people who have a very hyper-intense immune system, their conditions tend to be worse. So coming back to the principle that Kenneth, that you spoke about, is absolutely correct. We, as the people of God, with the health message that has been given to us, should be the first to be promoting health, the health message as the best strategy a most effective strategy in conjunction with all the other measures that we're looking at to give ourselves the best chance. And so we really need to go back to the whole story of the health and how we protect our health. Now, New START is always a good acronym that most people look at, and there are other ones that are around, but I think I'll just mention a few things really quickly along the lines of the New START principle. We know, for example, that nutrition plays a very big part in your health, very big part. So we're looking at the role particularly of that which affects the immune system, and you have to talk about the role of sugar. Sugar is a very major detriment to the immune system. We have shown by a number of scientific experiments that sugar can paralyze the effect of the white blood cells by as much as 50%. It's quite significant, and so looking at removing or eliminating as much of the sugar in the diet is going to be a very major part of one's health. Also looking at the role of sugar-related foods. Now, when we talk about sugar, people might be thinking I'm talking about the teaspoons of sugar you put in your food or in your drink. I am talking about things that are sugar-based. So a lot of the foods that we eat, which are high calorie, low in nutrient, those high calorie foods, sometimes called junk foods, one has to be very careful about its use. So minimize its use or eliminate its use if possible. So the donuts and the cakes and the candies and the soft drinks and all that sort of thing, those are things that we need to really be paying some really close attention to, because the immune system, if you get the disease, will not be able to mount an effective response. Where it comes to the things like meat, there's a debate upon the meat issue. I would certainly suggest that reducing your consumption of meat is probably a good plan, because the body still requires a certain amount of energy and nutrients, and particularly because a lot of the so-called meats that you're buying are high in hormones. So it's not even so much the meat of itself as it is the contaminants of the meat that you get a lot of the hormones. A lot of these meats they're grown in a hormone environment. So we normally say, look, you'd want to try and pay some attention to that as well, so make sure that you're not being exposed to a number of things that will suppress or affect the immune system. And then, of course, you go to things like exercise and the role of exercise. We know that exercise is a strong boost for the immune system. Of course, it's difficult to exercise when you're confined to home, but you can do exercise at home. You know, there's no reason why at home you couldn't be getting enough of your exercise to keep the tone of the body and the immune system activated. The other one that I want to go very quickly, which doesn't affect us as much as Adventists, but affects a lot of other people, is the use of alcohol and cigarettes. Now, alcohol, as you know, is a toxin. Alcohol is deadly. It's a deadly toxin, and so we are fortunate with the health message we don't drink. And also because of smoking, cigarette smoking, as we know, contains a large number of toxins, is carcinogenic, and it suppresses the immune system. So we normally advocate to people that they should avoid all those the toxic things that we do a lot. Get rid of a lot of those things. A lot of water is important to flush the system. You need to have water in the system because toxins build up in the system, and you want to make sure that the water is there to flush the system out and to keep the body healthy, rather than drinking things which are high in sugar and high sugar content. Things like, now, one of the things that has been shown to really be protective against COVID-19 turns out to be vitamin D. Now, normally you will get vitamin D from the sun, but if you're in a cold climate, a very cold country, even in Australia now, they're documenting high incidence of vitamin D deficiencies, which you would not expect in a country like Australia, which has so much sun. But the level of sun exposure is reduced, particularly among the younger, but also in the older groups. And so there is definitely a correlation between low vitamin D levels and mortality linked to the COVID-19. So if you can't get the sun exposure and so on, you need to really have a supplement that includes vitamin D in it, a vitamin D supplement that will assist in getting your vitamin D levels up to the levels that are required to protect you for the immune system. Now, I'm just going to that's a sort of, so we're looking at lifestyle things first. You should always look at that which is lifestyle related. We tend to depend so much on tablets and drugs. So you want to be lifestyle related. Now, let me just in conjunction with that, suggest there are a few things, a few supplements that you may find useful, which I think on basic principles. So there is no research on supplements and COVID-19. You know, we can't even research COVID-19, much less to research the role of supplements in COVID-19. So the only things we can say is what is based on what we will call first principles. What are the first principles of health, of things that will protect and support your immune system, that hopefully will help you if you're exposed to the COVID-19. But I emphasize there is no evidence for supplements in COVID-19 because there's no research being done. So I'm giving you what I would consider first principles. So first principles, certainly vitamin C. Vitamin C has been shown to be very useful in supporting the immune system, and you're looking at requiring about 500 milligrams a day. I take 500 milligrams twice a day. Actually, I take a gram twice a day, to be perfectly truthful. I use a much larger amount. So a gram twice a day. The body cannot naturally produce vitamin C. So man and the guinea pig are the only two species of animals that cannot produce vitamin C from sugar. All the other animals can. Vitamin C and sugar has a very similar chemical structure except for one molecule. And so most animals are able to take the sugar molecule and convert it in their body to vitamin C. Man cannot do that. And if we can't take vitamin C from outside, you get scurvy. And if you can't take vitamin C from outside, your immune system is affected. So vitamin C is one of the important ones. We mentioned vitamin D already. Vitamin D is very vital. We also know that there are certain other vitamins that are essential to health. Zinc has been shown to be very, very useful for the immune system, but you have to combine zinc and copper. So zinc and copper act as what's called a solubility product. If you take zinc by itself, your copper level drops. If you take copper by itself, your zinc level drops. Zinc and copper act together in a balanced solubility product. So if you're taking zinc, you have to take copper, a supplement with copper in it as well. So we normally look at the role of zinc as well. And normally I would recommend everybody take a vitamin B complex. Normally what I call a mega B complex, so it's a high dose vitamin B, because you need vitamin B to support many of the processes that are involved in the immune system. We look at magnesium. Magnesium is yet another element that is involved in the immune system regulatory process, particularly in terms of the role of the mitochondria. The mitochondria is the powerhouse of the cell. If your mitochondria is not working, the powerhouse of the cell, your cell doesn't work well. If your cell doesn't work well, you will succumb to disease. Magnesium is a cofactor in a number of those coenzymes in the mitochondrial system. So those would be sort of the vitamin mineral things that would be considered, I'd say, useful to you. I would add just a couple of herbs, therefore, a number of herbs I will just add to the program. The one that I would always recommend is milk thistle. Now, milk thistle is a herb that supports the liver. Now, the liver is a very important part of the body's chemical clearance system, the clearance of toxins. If your body is overwhelmed with toxins, if you're on medication, if you're taking lots of alcohol, drinks, caffeine, all the sorts of things, the liver becomes toxic. And if the liver is toxic, it can't metabolize the additional toxins, your body becomes toxic, your immune systems become affected, and you will succumb to disease. Milk thistle is the only thing that has been shown scientifically to support liver function. So we recommend milk. I recommend milk thistle. I take it myself. I recommend milk thistle to all my patients. They are on milk thistle as a liver protectant. The other thing that would be shown to be very useful for the immune system is golden seal and echinacea. Golden seal and echinacea. Again, these are two herbs, both of which have been very, very well documented in terms of the immune support, the benefits in the immune system. And so we normally recommend golden seal, echinacea as a supplement, and I take them as well. Nothing I say to you I don't do myself. I would never do that. I'm not prepared to share something with you that I myself am not doing. So I do use a golden seal, and I use the echinacea, and I use the milk thistle as the herbal support for the immune system and the liver. So that's a sort of balanced answer. Get your lifestyle right by proper nutrition, exercise, the use of water, making sure that you're avoiding toxins that are coming into the system, the alcohol, too much of the caffeine, the cigarettes and all that sort of thing. And after you've done all of that sort of thing, there are some selected vitamins of which I've talked about: vitamin C, vitamin D, the role of vitamin B, those three. and I spoke about 3 herbs, which is basically milk thistle, golden seal, and echinacea. So I've tried to summarize what I think would be the best advice, scientific advice I could give you, where I think the science supports it. Now, you can hear lots of other information. You could take every herb in the book. You can do that. It's very expensive. You may not necessarily get much more benefit than what I've told you based on the information I've given you. I try to be scientific. That's what I can support from a scientific point of view. And hopefully that will give you the best chance you have in a very difficult world to survive the onslaught of the COVID-19. Thank you very much. Yeah, no, the answer to that is yes, it is safe as far as we can tell from the testing, but those safety studies are still ongoing. So it's a difficult and almost a muted answer to that question, because most vaccines will take anywhere between 3 to 5 years to come into commercial production because of the safety studies. So it's hard to answer, is it safe, unless you have done the time. Safety is a time study. It's a time factor. The vaccines have been tested for maybe a month. We do not know the answer to that question. So a lot of that is going to be monitored, ongoing monitoring along the time. The only problem is that because we're in the face of a very difficult pandemic for which there is no drug answer. Right now, there is no drug answer to the virus. The people have gone for what is called emergency use of the vaccine, which means to say that they have accepted that all of the testing has not been done, and that effectively you're doing a phase 3 trial with an ongoing commercial and medical use of a vaccine. That would not normally be done. I'll just make that point very clear. What's happening right now with the vaccine would not normally be done, because there isn't enough time. The vaccine has not been tested long enough to give an answer to, is it safe? It is as safe as it could be, considering the nature of vaccines that are produced. So basically what they do is they say, look, we have produced a number of vaccines, and we have tried to follow the same protocol for producing these vaccines, so therefore it is as safe as any other vaccine produced along those lines are. That's all that can be said. Now, let me just give you the other dimension of that. The answer is, if there have been some people already shown side effects or allergies, many minor allergies, minor allergic reactions to the vaccine. So the current advice is, if you have an allergic tendency, if you suffer with allergies of any form or kind, you should not be taking it, because we don't know what will happen. Where it comes to people with asthma, there is some caution for some of the vaccines about people who have asthma. They don't know what will happen. And so that right now is still an open debate as to whether people with asthma should be taking it. But I think asthma generally is has quite often an allergy association. People tend to have allergy as a predilection or a tendency. So I think the asthma one is still considered open for debate. In terms of the longer term impact of it is governments are currently indemnifying the companies. So all the governments that are currently using it, and I don't know if you've heard that, are currently indemnifying the companies that are producing it. The governments are indemnifying the companies, so that they basically have said, if there's a problem with the vaccine as it has been used on its ongoing, because it's an emergency use, that has been approved, then the government will foot the bill for any problems that occur. But we don't, to answer the question, Inez and ladies and gentlemen, we don't know. We don't know the answer to that question. But it is a muted one, because in the current climate, you will be given it. Now, I'll give you 2 aspects of that now, and I can only comment on this. There is a high chance, a high possibility, that you will not have a choice. So when the vaccine was first being considered for Australia, the word came out from the government that you'll be forced to take it. Now, that's exactly the word that came out. So I stand without any fear of repercussions. The word was, you will be forced to take it. Now, about a week later, the government retracted on that, Because it's an amazing thing to say in a government, in a democratic state, that you'll be forced to take something. That's actually quite novel in a democratic state. But the government did come out and says, no, we won't force you to take it, but they would literally make it a bit challenging to say, well, you can't work here, you can't do this, you can't do that, unless you can't go to the supermarket or wherever it is, unless you have the vaccine. So, for example, myself as a doctor, I would not have a choice. I would not have a choice. I would have to take the vaccine, because if I don't take the vaccine, I would not be allowed to work. That's just where we're at. Now, as I said, it's just because the world is on its knees, the economies of the world is crashing, people don't know what to do, and we are really in the place where things are happening, things are being done that we are being forced to take. The world is forced into this place because of the pandemic. Now, where that will, I'm not going to put a spiritual link to that, and so this is not a statement in regard to the COVID vaccine. I'm now making a spiritual link for everyone. If you just imagine that a vaccine, which is required because of the pandemic and how many people are dying and the fact that we don't have any other options, if we are being told you may be forced to take it, I wonder how easily everybody sees how easily the mark of the beast could come upon us. Very easily. Whatever that definition is, how easily no man can buy or sell except they have the mark of the beast. You'll see how easy that could happen, because we're already being told that in an emergency situation with a pandemic, you will be forced to take it. Forced to take it. So I think, do I recommend the vaccine? I think yes. I don't think we have very good options otherwise. As it goes on, we may have to modify that advice, but right now that's the only options we have. I still say, as Kenneth was saying, our health message should be paramount. We should be doing as much as we can to safeguard ourselves by maintaining good health. And then hopefully at the end, it's whatever happens is going to happen. The Lord is going to come, is going to bring in the final events. The Lord will come soon. We'll all go home. So whatever happens, don't worry. We're almost home. I believe that's the truth. I believe we're almost home. And I encourage you to serve the Lord. If you ever thought about not serving the Lord in a committed and a complete way, now is not the good time for that. Now is the time to bed down in spirit and with the Lord Jesus Christ and make your calling and election sure. I think we are in the midst of what will be, in my judgment, the final events before Jesus comes.